Bismillahirrahmanirrahim. Assalamu alaikum. Quote of the day. There are two blessings which many people waste, health and free time. This is the saying of Prophet Muhammad sallallahu alaihi wasallam. I am Dr. Aamna Khalid and I will be presenting on the topic of mad cow disease under the kind supervision of Professor Dr. Saira Afzal. The learning objectives of today's presentation will be the disease overview, epidemiological triad, Creutzfeldt-Jakob disease in humans, outbreaks and global burden, statistics of Pakistan, control measures, recent advances, and then the MCQs. At the end of presentation, we should be able to recall the brief overview of disease, its mode of spread, burden of disease, and its control measures. Here is a case scenario. A farmer in Belgium reports that one of his cows has been exhibiting unusual behavior, including reluctance to enter the milking parlor and hypersensitivity to sound. He also notes a significant reduction in milk yield and teeth grinding. Within a few days, the cow died. Upon brain biopsy, the appearance of the brain tissue looked spongy. A diagnosis of bovine spongiform encephalopathy was made. Here is another case scenario. This is a case of 28 years male who had behavioral abnormalities, unsteady gait, and myoclonic jerks. MRI and the FLAIR images showed abnormally increased signal intensity in caudate nucleus and abdomen. EEG revealed periodic synchronous biphasic sharp wave complexes. So, on the basis of history, clinical findings, MRI brain, and the EEG changes, diagnosis of CGD was made. What is the history of BSE, that is, mad cow disease, bovine spongiform encephalopathy? The disease initially occurred in sheep, where we named it Scrappy. From the sheep, it was transmitted to the cows, and we named it bovine spongiform encephalopathy, that is mad cow. From the cow, it was transmitted to the humans, and here we called it Creutzfeldt-Jakob disease. This is the pictorial presentation of the same discussion. On the left side, you can see that it is shown that the disease is occurring in the animals, in the farm animals, and on the right side, the disease is transmitted to the humans. For the clarity of understanding, I have divided my presentation in two parts. The first part will be on the disease in animals, that is bovine spongiform encephalopathy, and the second part will be the disease occurring in the humans, that is Creutzfeldt-Jakob disease. So the first part is bovine spongiform encephalopathy. It is a progressive fatal neurological disease. The word bovine in it means that the disease affects cows. Spongiform refers to the way the brain from a sick cow looks spongy under a microscope, and the word encephalopathy indicates that it is a disease of the brain. As the epidemiological triad includes agent, host, and the environment, the agent in this case is prion. What are the prions? Prions are misfolded forms of proteins normally found in the bodies of animals and people. And in an animal with BSE, prions are mainly concentrated in two areas of the body. Number one is the nervous tissue that includes brain, spinal cord, and eyes. And on number two, the lymphatic tissues like lymph nodes, bone marrow, and spleen. How the disease is transmitted to the host plant. Meat and bone meal, MBM. It is a feed made from dead cattle that contains prion-infected products from cows or sheep. So by feeding this meal, a cow gets BSE. Till now, there is no evidence of horizontal transmission. It means that the disease is not contagious, and there is little data to support vertical transmission. And the tough part is that prions are not affected by cooking meat. or by usual disinfection measures, or by rendering. Incubation period. It takes 4 to 6 years for symptoms to begin after an animal is infected with a prion. It means if there is an animal at the age of 1 year uh, and it gets infected by the prion, at the age of 5 or 6 years, it's going to show the symptoms of the disease. What are those symptoms? Um, the cow will be more nervous than usual and have trouble walking. It acts very aggressive or violent. That's why we have named it mad cow. It refuses to milk, increasingly hypersensitive to touch and noise, and the cow's hind legs become so weak that they are unable to even stand. Here we need to understand that there are two types of BSE. Number one is the classical C type, and number two is the atypical type of BSE that contains L or H type. And this is actually the classical type that spreads via feed that contains meat and bone meal or other proteins from infected cattle. The other one is the atypical, and that's not associated with contaminated feed, but these cases occur spontaneously. How to diagnose the disease? There's no reliable way to test BSE in a live cow. However, a characteristic sign of BSE is the startle response to some stimulus. So there are tests for overreactivity that are used to aid in the clinical diagnosis. Number one of them is bang test. Hitting a metal object with a hammer or a hand clap will elicit the startle response in the cow. Number two is the broom or flexible stick test. So by touching the hind limbs with an object will elicit the kicking by the animal. Or number three is the flash test. Exposing the animal to some sudden light will elicit the startle response. Then is the clipboard test. Waving a clipboard or even a hand towards the animal will elicit the startle response or even can panic the cow. In this article, the researchers have devised a decision support tool for clinical diagnosis of disease in cows with suspected bovine spongiform encephalopathy. And a few words from the abstract of this article includes a comparison of clinical patterns consisting of 25 signs that was made between all the 30 BSE cases they have taken in this study, confirmed in Belgium, and 272 suspected cases. The 10 most relevant signs of BSE they included were the kicking by the animal in the milking parlor, hypersensitivity to touch or sound, head shyness, panic-stricken response, reluctance to enter the milking parlor, abnormal ear movement, increased alertness behavior, reduced milk yield, teeth grinding, and temperament change. This chart is just to have an idea that how much difficult it is to diagnose BSE clinically and to differentiate it from other neurological disorders when there is so much overlap of the symptoms. Confirmation of BSE can only be done when a cow dies. Number one, by looking at its brain tissue under a microscope and seeing the spongy appearance. And number two, Western blot on the brain tissue. On the left side, the healthy brain tissue of a cow is shown, and on the right side, the brain tissue of a cow with BSE is shown, and we can see the spongy appearance of the brain tissue. This is how Western blot has separated the prions and it differentiates between different types of BSE. Treatment. There is no treatment for BSE till now. What we can do is to quarantine the herd to prevent the spread of disease. Number two, remove and destroy infected animals from the food chain and to provide advanced medical technologies and expert support to improve the quality of life of the animal. Due to the difficulty in diagnosing um, clinically the disease, there have been a number of outbreaks in the past. The first documented case of a cow was reported in 1984 in the south of London, and more than 184,000 cows in the UK died from BSE between 1986 and 2015. The outbreak was widespread, and more than 35,000 UK herds were affected. Cases peaked in 1993, and nearly 1,000 new cases per week were reported. Other than UK, cases were also reported in at least 24 countries. This is a graphical presentation showing the number of the cases BSE that peaked between 1990 and 2006, and after that the number of cases started to fall. As per the data of June 2024, this is the geographical presentation of risk assessment of BSE. Some of the countries are shown in dark green color and they have negligible BSA risk. Some countries are shown in the light green color. They have controlled BSA risk. And on the left side, United Kingdom is also shown in the light green color. Some countries are shown in the gray color, and they have not given any official BSA risk data. And in the next picture, you can see that Pakistan, shown on the left side, is also in the gray zone. It means Pakistan has not given its any official data regarding the risk assessment of BSE. There is no evidence of mad cow disease in Pakistan till now. How to prevent the disease at primary, secondary, and tertiary level? What we can do to control the disease is the surveillance programs that must ensure identification and follow-up of targeted bovines that lie on the clinical spectrum of BSE. Then the veterinary and agricultural students and professionals should be made aware of BSE, prohibiting the inclusion of meat and bone meal in animal feed, and destroying animals showing signs of BSE and other animals at high risk of developing the disease. As we have seen that the disease initially started from the sheep, so it is important to eradicate disease there in the sheep. So a national scrappy eradication program is running in United States of America. And the last positive case of scrappy was reported in US in 2021. Advances in scrappy disease diagnosis and genetics. In 2017, researchers tried to make some changes in the genetics of goats during the time of outbreaks. Here ends the first part, and now we are moving on to the Creutzfeldt-Jakob disease. This is a prion disease that have characteristic features of rapidly progressive neurodegenerative disease manifested by psychomotor changes that include cognitive dysfunction, motor disorders, and behavioral abnormalities. The disease is transmitted to humans by consuming meat from BSE infected cows, and this is the variant type of Creutzfeldt-Jakob disease. So we need to understand that there are four types of CJD. Number one is the sporadic form, where the cause is unknown and the cases occur spontaneously, and it is the most common form of CJD. On number two is the familial or inherited CJD that occurs by mutation of prion protein genes. On number three, iatrogenic CJD that spreads through contaminated medical or neurosurgical instruments. And on number four is the variant type of CJD, and this is the type that occurs by consuming infected cattle meat and sometimes also by the blood transfusions. So, what are the symptoms of variant type of CJD? It includes dysesthesia, depression, anxiety, withdrawal, and later on, dementia and poor coordination. How to diagnose CJD? On the basis of clinical findings, as mentioned earlier, CSF markers, MRI, MRI shows the hyperintensity in the basal ganglia and thalamus. EEG shows periodic sharp wave complexes, and all these tests are just helpful in the diagnosis. The only confirmatory test is the brain biopsy, and that shows the presence of abnormal prion proteins. Uh, this is the table showing difference between classical CJD and the variant type of CJD we are more concerned about right now. So the variant type occurs in a younger age group than the classic one. The variant type has a longer duration of illness, around 1 year, and the variant type has initially more psychiatric symptoms, but in the classic type, dementia is the early sign. In the variant type, there are no EEG findings, but on MRI, there is hyperintensity. And in the variant type, we can detect prions in the different tissues like brain tissue and the lymphoid tissues. Treatment and what is the prognosis of this disease? CJD is always fatal till now. Usually, the patient dies within a few months, and unfortunately, there is no proven therapy that can slow or stop the progression of disease. So, treatment involves only supportive care to comfort the patient. Cases of CJD in the world, as per the data given by CDC, till December 1, 2003, a total of 153 variant type of CJD cases were reported worldwide. And as per the data of 2019, 232 people worldwide are known to have become sick with variant type of CJD, but they all died. Cases of CJD in Pakistan. A number of case reports have been published in different articles. This is a case report published in 2014, and it shows that two cases of CJD were reported. The one was 62 years old female presented with rapidly progressive dementia and myoclonus, and the second patient was 72 years old female who, along with the RPD, rapidly progressive dementia, had also symptoms of generalized axial and limb rigidity, mutism, personality changes, and hallucinations. This case report was published in 2018 of a biopsy-prone case of CJD from Pakistan. This case series from PIMS Hospital, Islamabad, was reported published in 2023. But we have to note here that all of these case series or case reports reported the cases of classic type of CJD or the sporadic form, basically, not the variant type of CJD that occurs from the beef or the meat of cow. Here in this article published in 2024, some researchers shed light on the concerns and considerations regarding the risk of CJD in Pakistan through reusable laryngoscopes. So, what is the current risk and how to prevent CJD? Currently, the risk of getting CJD appears to be very small, perhaps fewer than one case per 10 billion if the risk exists at all. The travelers to Europe who are concerned about reducing any risk of exposure should avoid beef and beef products. Recent advances for the diagnosis of CJD. This article was published in 2017, and it shows that recent advances in diagnostic techniques, including real-time quaking-induced conversion and MRI brain scans, that have allowed more accurate case recognition of all the forms of CJD. Some recent advances were published in 2022 in the Lancet Neurology Journal, the prion protein monoclonal antibody therapy for CJD, the evaluation of a first in human treatment program. In this article, they treated 6 patients in this study, the 6 patients, 2 men and 4 women, for 7 to 260 days. Repeated IV dosing of PRN 100 was well tolerated and reached the target CSF during drug concentration in 4 patients after 22 to 70 days. There was no clinical significant adverse reaction. All patients showed progressive neurological decline on serial assessments. Another recent advance was published in 2024, the new implications for prion disease therapy and prophylaxis, and it stated that new perspectives on clinical and experimental prion diseases include immunotherapy, gene therapy, small molecule drug, and stem cell therapy. So this is all about today's presentation. Now it's the time for multiple choice questions. The first question, what are prions? Option A, prions are viruses that cause infectious diseases. Option B, prions are bacteria that lead to food poisoning. Option C, prions are toxins are produced by bacteria. Option D, prions are misfolded proteins that cause neurodegenerative disease.
D. D.
Yes, option D is the right one. Question number 2. What preventive measures can be taken to control BSE outbreaks? Option A, allowing the use of meat and bone meal in cattle feed. Number 2, B, regularly testing all cattle for BSE. Option C, vaccinating cattle against BSE. And option D, banning the use of meat and bone meal in cattle feed. So the correct answer is option D, and the references are also given on the right lower corner. Question number 3. What symptom distinguish variant CJD from classic CJD? Option A, persistent fever and chills. Option B, frequent seizures and convulsions. Option C, prominent psychiatric symptoms. Option D, severe headache and nausea. Option C is the correct answer.
C.
Question 4. What is the typical outcome of CJD? Option A, always fatal within a few months. Option B, chronic management of symptoms. Option C, recovery with supportive care. Option D, long-term survival with mild symptoms.
A.
Yes, option A is the correct one. Question number 5. A 52-year-old woman develops rapidly progressive cognitive dysfunction, motor disorder, and behavioral changes after consuming beef from a BSE infected cow. She has no family history of neurodegenerative diseases, and she has not underwent any surgery using contaminated instruments years ago. What type of CJD is most likely associated with her symptoms? Option A, the variant type. Option B, the classic type. Option C, the iatrogenic form of CJD. And option D, the inherited form.
B.
Option A. Question number 6. A 35-year-old man presenting to the OPD for the preceding 6 months with neurological abnormalities such as ataxia within weeks or months, memory loss, and disorientation. In the past 2 years, the patient said he had consumed a lot of beef meals. The most common cause of these symptoms is option A, abnormal carbohydrates in brain, option B, abnormal fats in brain, option C, Abnormal proteins in brain. Option D, minerals in blood.
C.
Yes, option C is correct. Abnormal proteins that are prions. Question number 7. How long does it typically takes for symptoms to appear after infection with prions? Option A, 1 to 2 years. Option B, 10 to 12 years. Option C, 2 to 4 years. Option D, 4 to 6 years.
Option C.
C.
Option D is the correct one. Question number 8. The country most affected by the BSE cases and outbreaks. Option A, Belgium. Option B, UK. Option C, USA. Option D, China.
B.
Yes, option B is the correct one. Question number 9. A farmer in Belgium reports that one of his cows has been exhibiting unusual behavior, including reluctance to enter the milking parlor and hypersensitivity to sound. He also notes a significant reduction in milk yield and teeth grinding. Concerned about BSE, he seeks advice on diagnosis. Which behavioral change is most indicative of BSE in this cow? Option A, staying asleep. Option B, increased food intake. Option C, more time spent grazing. Option D, kicking during milking.
D.
Yes, option D. Question number 10. How do prions primarily affect the body in BSE infected animals? Option A, they enhance immune response against infections. Option B, they disrupt hormone production in glands. Option C, they accumulate in nervous and lymphatic tissues. And option D, they cause inflammation throughout the body.
C.
Yes, option C is the correct one. So this is the MCQ's key, and this is the YouTube channel where today's presentation will be uploaded. Thank you so much.